No mai haere mai, and welcome to Cult Chat, the podcast where we talk about coercion, control, and all things cultish. I'm Dr. Caroline Ansley. I'm a medical doctor. As a child, I lived at the Centrepoint community, a notorious cult in New Zealand, and now I run a website that advocates for the former children of the community.
I'm Liz Gregory, and I run the Gloriavale Leavers Support Trust, and I'm privileged to walk alongside people after leaving this group as they embark on their new lives.
And I'm Lindy Jacob. I'm a former member of the Exclusive Brethren, and I'm part of the Olive Leaf Network, a new initiative in Aotearoa to support leavers of high-demand religious groups.
Come with us as we unpack the cult playbook. We'll be talking to experts and leavers of coercively controlling groups, and we will call for Kiwis to cult-proof their lives.
Come with us as we traverse the cultiverse.
A warning, this podcast contains references to subjects and discussions which may be difficult for some people to hear. Please take care of yourselves and your whānau when listening. Hello everyone, welcome to Cult Chat. Today we're going to be having an interview with a really fascinating clinician called Dr. Cyrus Abbasian, a psychiatrist that I recently met in Montreal at the International Cultic Studies Association conference. Sit back and listen to our chat, and then you can hear Lindy, Liz and I talk about the interview afterwards. Welcome to Cult Chat. I'm very excited to introduce our audience to Dr. Cyrus Abbasian, who's joining me from London. Dr. Abbasian is London-based and trained psychiatrist specialising in adult psychiatry and addictions with additional expertise in trauma and ADHD. He has over 25 years of clinical experience. You can learn more about Dr. Abbasian by viewing his LinkedIn profile, which we'll put in the show notes. I met Cyrus in Montreal recently when he gave a presentation entitled A Psychiatrist's Perspective on Cults. This was one of the most fascinating talks that I attended, and hence I was really keen to get him on the show. So welcome to Cult Chat, Cyrus.
Thank you so much for inviting me.
It's lovely to have you. Could you tell us a little bit more about yourself, Cyrus?
Well, I graduated from King's College London, and I went straight into psychiatry. And I've been practicing for over 25 years. I worked for UK's National Health Service for a good 23 years, but then I left, so I'm self-employed now. So I do have time to do other things rather than just focusing on my NHS work. The work that I did for the NHS was working in a community mental health team, and it was mainly dealing with severe mental illness, mostly schizophrenia, severe depression, schizoaffective disorder, bipolar affective. So those conditions that overlapped with a lot of substance misuse. So I'm an addiction expert, but I mostly see dual diagnosis cases. So these are cases who have substance misuse plus another relevant mental health condition. In recent years, I'm working privately, and I also learned to do adult ADHD and then adult autism assessments, which is very interesting. Certainly, I tell a lot of my colleagues, mental health professionals, to learn about adult ADHD and autism to see how it impacts mental health conditions and addictions, and particularly the sort of, I think the triad slide I had in my presentation in Montreal, triple diagnosis, where you have neurodiversity, substance misuse, and a mental health condition that can really increase risks in that individual. I'm also a digital psychiatrist, which means I don't see patients face to face anymore. I work fully remotely. I'm at home now in my office. And we set up a company called Psychiatry UK around 12 years ago. And it's really taken off. And basically, we were the pioneers of doing telepsychiatry, which became digital psychiatry with the introduction of AI in particular, which we also use. So I'm a big advocate of AI, anything digital. I'm a big, although I work privately, ultimately, I think that health service, particularly mental health service, should be available
Mm.
uh, at an affordable or free rate for everyone. That kind of democratic principles are really important, so everyone can access a mental health treatment when they need it. Hence remote, hence a utility of AI to augment that kind of provision. Obviously, it can't replace it right now, but just it's good augmentation for it. Regarding my interest in cults, um, again, it's been twofold. Firstly, it's been my own experience as a clinician in the past 25 years,
Mm.
particularly with respect to Scientologists. So, yeah, so the first one of the first, or maybe the first psychiatry conference I attended in the UK as a junior doctor, I believe it was in Glasgow. It was the sort of the main annual Worker Psychiatrists conference. There was a demonstration outside, and I was really surprised that it was quite noisy, quite colourful, and there was a lot of anger, a lot of vitriol. Oh, you bloody psychiatrists, go home, stop, drugging our children, stuff like that. And that was my introduction to Scientology. I mean, I knew very little about them, so I did some reading and I wanted to understand where the sort of the anti-psychiatry perspective comes from. And more recently is within context of extremism. I do I'm aware of the research that is being done by security services in particular. And there's a lot of money in the West, not just in the UK, in anti-terrorism measures. And in the UK, the commonest reason is Islamic, followed by right wing.
Mm.
And they've looked at how these organizations operate, and that kind of the cult-like research that we have, this kind of high control groups are not dissimilar
Yeah.
to, for example, how a Muslim becomes radicalized.
Yes.
And that kind of silo, echo chamber they get into, and then, they're brainwashed and they conduct really horrible things. So I just want to I mean, I'm from Iran myself. I'm an immigrant and from a Muslim background, and I just want to understand why these people, often sort of second, third generation British Muslims who were born in the UK, there's, we have free healthcare, we have free education, there's social support, there's so many opportunities here.
Mm.
But they sort of pack their bags and they kind of groom them, brainwash, and go to a place that they know nothing about, and then commit these atrocities. So the more I sort of research into this, the more I realize that neurodiversity is an important factor here, with the push and pull factors and executive dysfunction that can predispose individuals into getting into these extremist groups, which is not dissimilar to cults.
Mm.
So yeah, so basically that's the reason I went to Montreal. It was a jazz festival as well, so I thought, yeah, I might as well, go and enjoy myself at the same time.
Oh, wonderful. So that's a great background, and certainly I have been very conscious of, in particular, Scientology's strong, very aggressively negative view on psychiatry. So does it does in some ways highlight, and you talked about this in the conference, about the vulnerability that occurs when people with serious mental illness are unable to get timely evidence-based mental health treatments and are then kind of pulled sideways potentially into unregulated organisations which promise healing, like potentially Scientology with their non-evidence-based auditing practice. They can fall through the gaps in the health system, be picked up by other groups. Could we kind of talk about that? Because you said you had observed that yourself as a practitioner.
Yeah, well, I mean, there have been a couple of cases, and I mean, there's one particular case I cannot forget. So there was a gentleman, a young man in his 20s, who had a psychotic relapse. And for the audience who are not from mental health background, a psychosis is losing touch with reality. Basically, people can hear voices, can feel paranoid, can feel scared. and often they lack insight into the way they are. And he was at home with his mother, and his mother had desperately been trying to get help for him. And we have the Mental Health Act in the UK and their equivalent acts all over the world. And so basically, the final, you try everything. And if you don't get anywhere, you have to go to court, get a warrant and go with the police, and then force them to bring that patient to a place to be assessed and then admitted. And when we turned up with the police, he had signed a piece of paper saying that he doesn't consent to being admitted under Mental Health Act. Because as far as he's concerned, there's nothing wrong with him. And I kind of wish I'd taken a photo of that paper that he'd signed. But it basically was it was on a headed paper, and it was linked to this organization that's affiliated to Scientology. And I mean, obviously, I explained to him, and the police was there, that we have a warrant. Mental Health Act is an act of Parliament. You can't opt out of it. You live in the UK, you have to abide by the rules. And I explained to him that he has the opportunity to appeal, and he can have representation as well. And yeah, I mean, we finally brought him in. But I mean, my thinking was that, okay, if this wasn't there, maybe we could have brought him earlier, and maybe he would have been persuaded to come for treatment earlier, and he wouldn't have been left this long. And yeah, and
So
I
his
think, I mean,
so
we
it
have.
sounds like his psychosis was in some ways enabled to be untreated because he was seeking care through another route that delayed his access to evidence-based psychiatric care, which then meant he presented very late in the illness, and had a more serious consequence for himself, because being committed under mental health treatment, no doubt it's very similar to in New Zealand, is a very unpleasant experience,
It
psychologically,
is.
socially.
It
It's
is very
quite,
unpleasant.
yes,
It's very
and
traumatizing as well.
yeah, it has very significant
And I
impacts
mean,
for the person.
interestingly, I mean, I don't like the Mental Health Act.
Mm,
And I mean, I'm actually quite critical of psychiatry as a profession. Uh, there are a lot of valid arguments here regarding not having a Mental Health Act.
mm,
Because, I mean, the problem we have in psychiatry is stigma.
mm,
And if we combat this stigma, if we better educate the public, in the same way that when your arm breaks, I mean, you go to a hospital and you get it treated. Now, when your mind breaks, we should do the same thing. We shouldn't wait. We shouldn't be scared. We shouldn't feel marginalized and stigmatized. And we shouldn't worry about consequences in our ability to look after our children, drive, employment, etc. And I mean, I mean, I've had medical students who have that kind of one flew over cuckoo's nest mentality. They
mm.
think psychiatry is still like that.
Yes,
They think we give ECT without anesthesia as a form of punishment.
yes.
So there is a lot of ignorance there regarding what actually psychiatrists do right now. And what we did 70, 90, 100 years ago is very different to psychiatry at the moment. And regarding anti-psychiatry, I mean, it used to be a valid, well, a recognized academic discipline. And you still have people there. I mean, they're not psychiatrists. Some are retired psychiatrists, but you have maybe philosophers, sociologists, people who don't have a day-to-day dealing with mental health issues necessarily. And I mean, their view is critical,
Mm,
and they do some, obviously research to sort of to back up the criticism that they have of the discipline. And some of the valid criticism for psychiatry is over medicalization. We too readily give diagnoses, we too readily give medication, we too readily pathologize normal problems. and normal stresses and distresses and anxieties and traumas in life. And I think a lot can be done. I mean, I'm a big advocate of lifestyle medicine. A lot can be done before we actually get to have psychological or psychiatric treatment. And so I'm a big advocate of lifestyle medicine, particularly applied to mild mental health conditions, as it would prevent condition from becoming more severe and focusing more at the severe end of the spectrum when it comes to mental health conditions.
But that stigma that you were talking about with mental health can be very much used by high control groups who want to offer something else to draw in people who, by anyone's stretch of the imagination, are vulnerable because they're mentally unwell and their mental health needs aren't being met adequately. The group I was involved with, which I mentioned before we started recording, actually recruited people who were mentally unwell. And there is, I often hear people who are experienced in the cultiverse talking about how cults don't want people who are going to be a burden to them, but this group actually did want people who are mentally unwell. Not all of them, because they still wanted people to do the work, but their recruitment base was the unmet need of the community in a mental health way, in a mentally they were mentally not necessarily mentally unwell, but there were people who were searching for psychological treatment for their unease, whatever that was. And some of them were very mentally unwell as well. And so that's an example of exactly what you were talking about people not being getting the care they need and feeling already highly stigmatized by society, who don't recognize and respond well to their particular challenges.
I mean, I have a question for you, Caroline, if I may. What would be what's in it for the high control organization in getting people who are very vulnerable, who may not necessarily contribute to that organization?
I mean, in this group, there were plenty of people who were high functioning. They were middle class, educated. So they weren't all very kind of struggling with day-to-day function, but some were definitely like parents, a solo parent with a few children who had gone through a really difficult transition and also was severely depressed or highly anxious or maybe psychotic even. Why do they want them? My cynicism would say in this group, to access the children. That's my cynicism in that group.
To what, sorry?
To access the children.
Okay.
Yeah, because it was run by a paedophile, essentially. So that's my cynicism. But it's not always the case that the leader has got such a persuasion. Yeah, I mean, it was built around psychology. So people were very suggestible to the idea that the problems that were going on in their life were all on them. And so that's a particular kind of strategy that used by cults to make everything. It's always the case, I think, that everything is wrong with you, nothing is wrong with the organization. So that I think set this group of people on a certain path, that it was all right from the get-go. I'm the problem. Right from the get-go. So I guess they're more susceptible to that idea that they need to learn and grow, because that's where the set point that they have, that there's a problem with them. They're seeking treatment. There's a problem with me right from the get-go. Yeah. But moving on, I'd love to hear your thoughts on neurodivergence and how this overlaps with a vulnerability to, it's not just a vulnerability to recruitment, because we always talk about recruitment in high control groups, but I'm actually coming from the perspective of someone who was experienced a high control group as a child, and most of my peers grew up in high control groups of multiple different types. And what I hear from that population is, why is there so much neurodivergence neurodivergence in these high control groups? And I know you can't answer that because you're no cult expert, but I'd love to talk about how neurodivergence might present in a really toxic environment, what that looks like to survive, and your thoughts maybe on why there might be a higher rate, anecdotally, because I don't think there's any good evidence on this, but in high control groups or cults.
So I think the first thing to say is that, I mean, we can't say, I mean, my particular angle is within extremism, which I explained
Yeah.
in the cohorts that are fairly small. They tend to be convicted extremists that we have looked at. It is notable that neurodiversity is very high.
Mm,
And so, but the numbers are small. So we cannot say that so neurodiversity, the commonest type would be adult ADHD and autism. I mean, the other, I mean, dyslexia, dyspraxia, that's also neurodiversity. But when we talk about neurodiversity, it's mainly adult ADHD and autism. So the numbers are too small for us to say, that's a risk
hmm
that causes extremism or causes joining someone a high pressure, high control group. But within those cohorts, there's a lot more
Yes.
uh, neurodiversity than outside. So we've been trying to look at the pathways of what happens in order to aid, prevent this from happening, and also it goes into de-radicalization and prevention of future future crimes. Now, so we often talk about push and pull factors and executive dysfunction. So people with ADHD can hyper focus with a lot of intensity over short periods over one thing
hmm
they become really interested in. And executive dysfunction means that they don't really think long term about the impact of what they're doing because they're so interested in doing what's in front of them. And the trigger could be as benign as reading an article about bomb making in a newspaper.
hmm
I said, okay, that's my mission. That's what I'm going to do. They go online, they search, they do, and before they know it, they get arrested by the police.
Yeah.
And I mean, the anti sort of terrorist legislation is very draconian in the UK.
Mm.
You get hefty sentences just for, talking about or downloading terrorism-related material.
Let's hope we don't get caught for this conversation.
No. Yeah. So yeah, again, I mean, it's something that some people who are neurodivergent are not as aware of
hmm
what would happen, what the consequences would be,
Yes.
uh, and they're genuinely dumbfounded. I mean, they end up in prison, category A prisons. What the hell am I doing here? How did I get here? What happened?
Yes.
And yeah, I mean, as an outsider, I'm not a forensic psychiatrist. The sentences are are there to prevent these things clearly from happening again. To set an example, with autism, that kind of narrow, restricted interest
Mm.
could be something that they end up down the path of, joining an extremist group. And in Cell in particular, I mean, there are really interesting documentaries are involuntary celibate
Yes.
groups, which are mainly young men who have social anxiety, have really difficulty, meeting women, talking to them, having a relationship, and they externalize that. Say, okay, this is the problem. It's not me. The problem is with the society and women because they want X, Y, and Z, and I'm not like that. And that's turned into violence after discussions in these chat rooms with a kind of echo chamber effect and silo effect. And yeah, so we see a quite significantly high amount of adult autism in,
hmm
in these kind of extremist groups. And the best reference in the UK is CREST. It's an organization called CREST, CREST, and they are funded, I believe, mostly by the UK government, and they research particularly regarding extremism, what to do about it, how to prevent it, and how to de-radicalize individuals. And yeah, they talk about push and pull factors, this kind of restricted intense interest, which could be conspiracy theories,
Hmm.
anti-vaxxers. I mean, before COVID, I mean, in the UK, we are compliant. When a new vaccine comes, we go and we have the
Same,
jab.
same here in New Zealand.
I mean, but I think this in America, there's a tradition of opposing vaccinations for whatever reason. It's through social media. It's become pretty much mainstream. It's become a worldwide phenomena, and it does have an impact. I mean, I remember when I had my COVID vaccine. There was a 4 week period, and I booked myself in the last week. So I thought, well, okay, let me just wait a bit, and maybe there are some side effects and problems, and I'll go last. Which is a bit counterintuitive because you should really be the first one there to have the vaccine, so you're immune from this infection affecting you. So yeah, it has an impact on everyone. And again, so going back to Crest regarding the work they've done, they looked into fantasies. People have this kind of vivid extremism-related fantasies, which could signify high on autism spectrum. That kind of obsessionality, repetitiveness that we see again, problem with social interaction and communication. People with autism have really difficulty socializing with others. That leads to isolation, social anxiety, and resentment. And potentially someone like that could, contact an extremist group, and they're welcome within that
Yes,
group. They are that kind of love bombing happens. I said,
yes,
oh, these people
exactly.
don't bully me,
Yes,
don't stigmatize me. So
yes.
yeah, it's a push
It's
and
the
pull factor.
And it's the same with cults, isn't it? Because you're describing extremist groups who I'm presuming have a particular agenda that they want to achieve in the world, and cults, I would say, or it depends on the cult. Obviously, they're a very heterogeneous, that they will have different agendas, but ultimately it is to pull that individual into their sphere of influence and retain them, and it's not in their best interest. It's to use them as what is called, by Margaret Singer, who's a cult expert, who's now passed away, a deployable agent for the group. And so the strategies, I think, are, you said, love bombing and making someone feel really welcome. Same strategies. And I guess there's the recruit who gets pulled into, whether it's an extremist organisation or whether it's a cult, which one could argue is often extremist, but not always. Um, and for that individual, I guess I'm interested in. We talked about what might attract them, but there's also those factors that increase their susceptibility. For instance, like you said, talked about stigma. Like maybe feeling less welcome in this world because of their difference, less understood. I also wonder about social ability to judge social cues and recognize, and tell me if I'm wrong, recognize, or a naivety about people's intention, which I think many people have already. But is there an increased susceptibility to miss some of those subtle social cues that could tell you that this isn't okay, actually? Why are they giving me so much attention? What do they want from me? And I don't know if that exists as well.
Yeah, absolutely. Absolutely.
Yeah.
This is why it's so important for clinicians, particularly psychiatrists, to be aware of ADHD and autism as two really relevant diagnoses in patients they see on a day-to-day basis, and also be aware of the vulnerability when it comes to joining extremist and also high control groups. And in fact, in the UK, we have prevent training, which all clinicians have to undergo. And basically, we learn how to, we need to be mindful that our patients could potentially be vulnerable
Mm.
um, to in joining extremist groups. And there is so I mean the health sector is provided funding through the Department of Health. The Home Office is responsible for criminal justice matters.
Yes.
So the Home Office who tends to fund a lot of these organizations, and the safeguarding aspect of it, which is prevent. And obviously, the priority isn't so much the patient, but it's to prevent, harm being done
That's
to
right.
the public. However,
Mm.
as a clinician, our role is being a clinician.
Yes.
So forensic psychiatrists tend to separate the person from the disease,
Hmm.
which could lead to harm towards others. And so these individuals, we treat them as patient, irrespective of some horrendous things that they may have done.
So let's talk a little bit, if you can imagine. I know you're not an expert in cults, but you know a lot more about neurodiversity than I do. Let's imagine an organization that may have more effectively recruited from the neurodivergent population and end up maybe with a higher percentage of neurodiversity in that group. And then the love bombing and all that wonderful stuff eases off and the exploitation ramps up. And maybe some of the people who have less vulnerabilities or more resources outside the group leave. And then maybe you have a higher percentage of people in the group now who have neurodiversity. And then they reproduce, and there's a second and a third generation who now have been socialized that this is normal, that this is the world that we live in, and we don't really understand the world outside now. And along with that, there's strong insider-outsider. The world is bad and frightening and scary. The information's restricted, so you're given a whole lot of false information about the world out there. Can you imagine what that looks like? I guess I'm trying to sort of tease out these questions I'm hearing from the second and third generation. Why is there so much neurodiversity in our generations? Is it as simple as that, or have you got some other thoughts?
So, I mean, yeah, that's a very interesting and relevant perspective. All mental health conditions, including neurodiversity, which you could argue is not a mental health condition,
Yeah.
it certainly has a strong genetic component. And we always, get a family history and find out whether there is a family history where the parents, siblings, they have ADHD and autism, and often they do. So these things do run in families. And yeah, so if you have a high control organization and people with autism get attracted to it and they remain, and we mustn't forget, ADHD, people with ADHD are very chaotic.
Mm.
So they come into something, they change their mind, move on to something else. And it's that impulsivity that you have in ADHD, you don't have in autism. So based on that, it's more likely for people with autism to end up in these situations, and they marry, they have children. So you could have a community of with a high percentage of autistic individuals. Because routine is very important to
Yes.
someone with autism. That repetitiveness is also something that they like, and because they get they're hypersensitive, for example, to stimuli. As I explained, that difficulty with meeting strangers, picking up social cues, and there's a lot of predictability. And yeah,
Yeah,
people with
except
autism
children.
are,
I can't imagine it's very good for the children though, because their particular needs as they're developing in, say, a school system or a social environment or a family outside such a group, they'd be getting additional resources and supports for their learning so that they don't end up being increasingly isolated and learn that they are get all those negative associations that happen when a child does not have their neurodiversity recognised and supported. And in these many high control groups, I think that is absent, the support for children who are growing up. And in fact, they are quite often bullied and marginalised. So that an adult, the additional neurodevelopmental trauma of a child raised in a high control group who is neurodiverse genetically, I would imagine is fairly substantial. And that's certainly what I've heard anecdotally. Thank you. That's really insightful stuff that you've shared about that. I guess I'm just thinking about the time and what we've got left to talk about. Have you got any thoughts about, I'm sure you do, about the role of coercion and in capacity to make decisions and how that fits in? I have grappled with the role of coercion on mental capacity and how coercion affects a person's ability to decide for themselves and impacts mental capacity. And I think it's really relevant when it comes to group coercive control and health decisions. For instance, refusing blood products if you're from a certain group, or there's a cult that I've recently become aware of in Australia called the Jesus Christians, and they're also called the kidney cult. And the kind of ethos of that group, one of the ethoses of that group, is to volunteer their kidneys to strangers. So donor volunteers, and a number of the people in that particular group don't have a kidney. And there's a high coercive element, obviously, in their healthcare decision making. So I'm just wondering if you had some comments or thoughts.
Well, it is very topical, coercive control. I mean, we're having a huge debate right now regarding assisted death, assisted suicide. I mean, the debate here is partly with respect to euthanasia or assisted death. Partly, I mean, most clinicians are aware of it, and it's basically in context of relationships. It's usually, it tends to be a female in a relationship that's abusive with a lot of coercive control. I think as a society, we are becoming more aware of what the risks are there of coercive control. It's a very, I mean, clinicians, I mean, we have so many things that we need to be aware of, we need to learn about, we need to be mindful of, we need to, I think that kind of public education is a really important aspect of preventing a lot of things, of empowering the citizen, the individual.
Mm.
This is a cult. This is coercive control. You shouldn't be doing this. So they actually become more responsible for their actions. And then the ones who come to us obviously would be the more vulnerable, those with mental health issues who are more predisposed when it comes to coercive control. And yeah, again within context of extremism, that's something that has been noted.
Mm.
People who do get recruited, it is a form of coercive control.
Yes.
So that the sort of kind of the leader at the top,
Yes.
whomever they may be, they are psychologically manipulating the people, and they put them in a really difficult situation whereby they cannot leave. Or if they leave, they actually feel at loss. They feel really, is that the traumatization that they experience means that they can always go back to the organization and do whatever they can. Because if they leave, then they become depressed, they become
Yeah.
suicidal. They've lost many years of their life. They have dissociation, post-traumatic symptoms. So it's a very difficult situation that they get into. So I think ideally we need to
Yes.
prevent this from happening, and as soon as it happens, we sort of get those people out of these relationships.
And the overlap, I'm just sort of, the penny's dropping here, the overlap with assisted dying in some ways, because these people are making the choice, in some of the cases of extremism, they are making the choice to die. If they're actually becoming a suicide bomber, for instance, that they're choosing to take an action that ends up in their own life ending. So there's some similarities
How
there,
do
you
they
know.
end up? I mean, the steps that
Yeah, the
you know
steps, the
they
steps,
have to
exactly.
take
But
on
they're
that journey
exactly
to
they're
do
coerced.
something like that, which is counterintuitive,
Yes, and they're coerced the
because
whole
we
way.
are here to, that kind of death instinct. I know Freud did talk about it, didn't he? But most of us, we want to live.
Mhm.
There's a lot of pressure on us. We love life. That existential, worries that we have is one reason that is what keeps us awake at night. Okay, let's do this. Let's be healthy. Let's do exercise. To live as long as possible, and to be healthy. So it is, yeah. I mean, well, one reason I started studying the field is, well, why would someone kill themselves in such a manner?
Mm,
And the term death cult has been used to describe these organizations.
yeah,
And again, I'm from Iran, and I've looked at the political structure of countries that are dictatorial in nature. And again, it's very much cult-like organization
yeah,
with the supreme leader on the top, and this kind of mystic spiritual aspect of it, idea of heaven and hell, and the idea of that, oh yeah, if you this is a great cause that you have to sacrifice yourself, and you could be martyred, and there's great reward for you in the
mm,
afterlife.
hmm,
And yeah, I mean that's a cult for me.
yeah,
Uh, that's a for me to it's a really good weapon for me to understand how these sort of these governments operate.
or maybe cults are small dictatorships, which is the other way of looking at it. I'm just wondering, as our time has run out, have you got any other kind of thoughts that you'd like to share before we finish? This has been such a fabulous conversation, and yeah.
I think, I mean, the reason I attended the Montreal conference is because it's a very relevant area. I think it should become mainstream, the research that's done in cults. With social media, we live in the internet age. Obviously, there's AI now that could really influence how people think. We can have AI cults.
Mm,
I'm sure there are some AI cults there already. And it will have global impacts. Whereas, when we talk about cults, we usually refer to the fairly small. I mean, yes, there could be thousands of people, but still relatively small in isolated places. So it could potentially become something quite global, that we need to be aware of. The kind of Orwellian risks and
yeah,
Orwellian fears could become reality. And yeah, I think one area that we need to look at is the politics. I mean, the term, the death cult is used, for example, to describe Hamas, and also the Republicans are, the term, Trump's cult is being
mhm.
used to describe, these hardcore, pro-Trump Republicans as well.
Yeah, yeah, I think it has got global implications, and you're right. That's one of the reasons I'm doing the work I'm doing, is to try to kind of stop that stereotyped idea that cults are just something in the corner, but they're not. They're not. They're much more prevalent than we realize, and there is that, as you say, that the cult-like thinking that's creeping across the world. But it's been so fabulous to have you, Cyrus, and I really appreciate you giving up your time and zooming in from the other side of the world. And yeah, very appreciative. Thank you very much. We're gonna.
Well, it's Saturday evening now, so I'll probably go for a pint. I'm not sure it's Sunday morning over there. Is that correct?
Yes, it is, and I'm going to get up and wake my family up.
Okay. Enjoy your Sunday, and I'm going to enjoy my Saturday evening.
Yes, thank you so much.
Thank
Awesome.
you.
Ka kite. Okay. Bye-bye. Hey, Liz, Lindy, it's lovely to see you both. I'm really looking forward to your thoughts on that interview that I had with Cyrus. Tell me what you think.
Wow, that was fascinating. And what a massive topic, the topic of neurodiversity. The thing about neurodiversity that fascinates me is that it can come with such incredible strengths and talents and capabilities, as well as kind of on the flip side, sometimes coming with really profound vulnerabilities and sometimes disabilities and big challenges that make people particularly vulnerable to cults at like both ends of the spectrum, right? Which is kind of what we were talking about there. Liz, what did you think?
Oh, I had so much going through my mind, and it kept casting me back to just conversations that I had even like yesterday and last week and last year with quite a few former Gloriavale members becoming aware themselves of neurodiversity and links with their family members who are still inside. And I've just started mapping out a little bit of sort of a family history from the different family lines that have joined Gloriavale over time. And I became aware that it looked like there was a pattern forming, but I wasn't able to get my hands on really good cult research in this area, but relied instead on some of the work like that Dr. Cyrus was talking about. There are other fields that have examined these kind of vulnerabilities. For me, it's making a lot of sense of what we're seeing. A former member actually was here this week, and I had some printed material, and it was indicators around, ADHD and autism, and they went, oh, wow, this is just like explaining my life. The need for rigid boundaries. There were just a whole lot of parts of it. And I know that some of the families are actually looking at now having some assessments, even inside Gloriavale. There's a bit more of an awareness now. And our trauma understandings are increasing. And there's a lot of talk about some of the traits mimicking those that look like ADHD and autism and or exacerbating them. And so
Sorry, that's a really important piece. So I'd just love to rephrase it to make sure I've got it, got what you're saying. Are you saying that there is research or talk now saying that the symptoms and impact of trauma on individuals or their families has got significant overlap or similarity with neurodivergent symptoms?
There's a lot of research in the trauma world around that. Yes, what we don't have is the research to link that in with the culty world, except all you need to do is look in the culty world and what we know about it. And there will be work out there, but it needs to grow in the research bodies.
That's really challenging, Liz, because again, if I heard you right, you just before you mentioned that you have been able to map out patterns within families from the families that you know of Gloriavale. And I presume you meant patterns of neurodivergence. But, are you also kind of saying that, well, actually, maybe those are patterns of intergenerational trauma rather than neurodivergence?
That's where the research, very clear, environmental stresses in pregnancy. Kaz, you're a physician.
Well, I would say that when it comes to assessing a child for either ADHD or autism, and that they highly overlap one another, that a trauma history is critical, so that the diagnosis isn't faulty as a result. That's why that's part of the reason why it's a complex diagnosis, because you have to understand the background. And if we think about how kids' development is so skewed and so harmful in a high control group, they can't develop on a normal pathway that is uplifting to their identity development and their social development and psychological development. They're going to look really different anyway with that kind of history. So it is. I can imagine it's quite a complex diagnosis in a high control group because it's so overlapping of so many other traits.
And I think just even looking at environmental stresses that we know that play into trauma. You've got just even the stress in pregnancy, the high cortisol. You've got pregnancy complications, and often those go on inside cultic groups. You've got exposure to toxins, and look, there are lots of things that go on in cults where it's not your ideal situation. And so I think some of the work I was doing just suggested that high genetic factors for neurodivergence, ADHD, autism, dyspraxia, dyslexia, quite a high dyslexic population in Gloria Vale. And then you just need to feed back and go, well, I've got 10 children. That means it's possible you've got in a large cult setting, you might have 5 or 6 of your children. And then you're intermarrying within that group. And then, yeah, that's quite significant.
And chuck in all the social factors that go with being different and behaving in a way that doesn't fit in with the environment, like being kind of having a rigid approach and needing structure, and someone is telling you have to do it this way, not the way that is comfortable to you. You may not be as compliant as a kid as the group requires you to be. And how does the environment cope with you being different? And I would say terribly. A cult will really not attend to your difference and your needs, including not getting educational support, not getting support with parenting, all the things that allow a child, a young person, an adult to be fully who they are. And I would suggest, is neurodiversity a problem, or is it that society doesn't accommodate it? And I would suggest it's society that doesn't allow for this difference and celebrate this difference. That's the problem. And in a cult, it's obviously a microcosm of that. A neurodiverse person may not be as able to simply comply and do what they're told. And that can look like behavioural problems. And in an environment where parents aren't supported to be the experts on their kids, and behavioural management strategies are very harsh, then they can be targeted, abused, bullied, isolated, and at the same time not getting their the supports they need to adjust and be in an environment that doesn't support their needs very well, which is what might happen hopefully in a healthy school environment, for instance. So it gets really kind of complicated, and it wouldn't be nice to be that person.
No. And if it's compounded with extra trauma, think about what it's like for someone who leaves a group like that. I feel like it would be more difficult for them to actually even make the decision, because remember, the rigid structures around a culty group give some sort of brain rest. And someone who leaves that group would be highly anxious about their ability to create a structured, boundaried environment. I'm worried about them being, it's almost like they're more entrapped.
Sorry, Liz, could you just clarify? Do you mean that people are more entrapped if they leave because there's less outside enforced rigidities, or if they stay?
No, that I wonder whether they remain in the groups. They're more entrapped. It's more difficult for them to even think of leaving, that it might not be an option that they feel they can pursue. But we want to say, actually, out here, there is support. There is more recognition for neurodiversity. There's more help with trauma, and, kind, loving people can envelop in all the spectrum of people who've come from cults. Yeah, I think just some of his work, it was clear there's just this overlap in these spheres of radicalization, terrorism, coercive control, culty groups. There's a lot still for us to understand, but it's all the same mechanisms at play. When you want to control someone, you will exploit them, and it's easier to exploit people who have vulnerabilities. We're not saying that everyone who joins a cult has a particular vulnerability that we can put a label on, but we know that it's often at life transitions as well. But we can't deny the fact that there appears to be growing evidence, and even just, as I say, in the reflection of the Gloria Vale sphere, there were clear neurodiversity issues playing into who originally was recruited into the cult, and then just the genetic explosion with the large numbers of children they have, marrying other children with the genetic disposition, the trigger being pulled, and then you have what looks like just a hotbed of neurodiversity.
Yeah, after my interview with Cyrus, he sent me a link to a documentary that's just come out recently called Worldwide Hate, and I'll put that in the show notes. And it was really all about extremism in the UK. And he directed me to an interview at the end of the documentary with a man who was a former member of the Ku Klux Klan in America, and he'd been recruited in, and I believe he was out when he did the interview. And he said, these were his words, because he was a recruiter for the Ku Klux Klan. And he said, what we really liked when I was in was any kid with ADHD or autism. He said, find the needs that these kids have. You meet them and they become loyal. Once they bond with you, they will die for you. Those guys were some of the best producers of violence. There's no shortage of people who are suffering. Find the injury, exploit it.
Wow, that is horrific.
Terrible.
Mm-hmm.
Very sad. Exploiting people's desire to be loyal and to want to feel belonging and to do something good and useful. Exploit it.
And being marginalized and discriminated against. They were finding people who had some of these traits that weren't accepted in the world that they were part of, and they drew them in and used them.
Very sobering. And we will have to end our cult chat on that very sobering note, Kaz. But perhaps I can end with a quote from Dr. Cyrus himself. He said, when your arm breaks, you go to a hospital and you get it treated. And when your mind breaks, we should do the same. And he wanted to encourage people that there is help available for those who have been exploited, who are suffering, and we can always end on a note of hope. Thanks everyone for joining us today at Cult Chat. Make sure you follow us, like us on social media. Thanks again to Plains Media for their support of our program. We look forward to joining you again soon. Bye everyone.
Bye-bye.
Ka kite anō.
If anything in today's episode was difficult or upsetting for you and you would like to talk to somebody, we encourage our New Zealand listeners to free call or text 1737 for support from a trained counsellor. Or you might like to visit the resources section of the Olive Leaf Network website, where you can find a range of organisations and resources that might be able to support you. We would also like to remind you that the views and thoughts and opinions that have been expressed in this program are the speakers alone, and Cult Chat does not necessarily endorse or share them.